Great. So acne and scarring. All right. So what is acne? I know this is very, very common, but most people don't actually know what acne actually is. So acne occurs when your hair follicles become plugged with oil and dead keratinocytes. It causes whiteheads, blackheads, or pimples. So I'm not sure if you guys remember, but the skin is divided into three parts, right? The epidermis, the dermis, and the subcutis. The hair follicle is embedded within the dermis. There are also plenty of oil glands and other stuff in the dermis, and that is generally where the pimple forms within the dermis. So it's fairly deep into our skin. And yeah, so it happens when our oil ducts, which are connected to our hair follicles. Here, actually, an image would probably be best for you guys. Here right now. Let me just open the other slide so you guys can visualize where the pimple actually happens. All right, so there we go. This should be the picture. Come on. All right. So you can see here, this is a oil gland, right? This little pale beige thing over here is the oil gland. It's connected to the hair follicle. So this gland over here produces oil that goes into the hair follicle. And sometimes it produces too much oil, which causes an overabundance and swelling of oil at the base of the hair follicle. And that could lead to infection because, oil is the perfect breeding space for bacteria and all of those little other fungi that you don't really want in there. For example, there is this bacteria called P bacterium that is allegedly, nobody actually knows if it does, that allegedly causes acne to happen. So if you have an overabundance of oil, you have a greater probability of developing P. acnes inside the oil, and that ultimately leads to infection, inflammation, and the pimple occurs. A common misconception is that you can literally that a pimple will form within hours of eating something that you shouldn't be eating. Like, if you drink bubble tea, you're gonna get acne in the next couple hours. That's simply not true. It takes months for a single pimple to form. But eating certain foods that could exacerbate your condition will cause some pre-existing pimple that was going to happen anyways. It's going to speed up that process. So that's just something interesting. Okay, let's go on. All right, so there are six types of acne. We have our cysts, which are these large, painful, pus-filled lumps underneath your skin. So these are the most difficult to treat, period. They tend to be or stick around for months, and they're very, very difficult to treat without oral medications or without steroid injections. These are very, very large and painful, as you can see here in the picture. And then we have our nodules. So these nodules are large, painful lumps underneath your skin. So generally, these nodules tend to develop into what we'll call pustules. So these nodules don't really have a white tip. They don't really have that white liquidy substance inside it. It's just pure inflammation, very, very painful. And if you have a nodule on your face and then you press down on it, it's gonna like move a lot. It hurts a lot, and then there's a large area underneath it that also hurts. So that's what a nodule is. These are also pretty difficult to treat. They can stick around for a week or two before they go down. And then we have our pustules. So pustules are pus-filled lumps, and these are generally develop out of nodules, or they just form by themselves. And generally a lot of people, when they see a pustule, they want to pop it. That's probably not ideal, because it's going to cause a rupture in the skin that could lead to the formation of scar tissue. And we do not want scars. Those take a long time to go away. And then we have our whiteheads and our blackheads. A lot of people don't think these qualify as acne, but in fact they do. They can be some of the most difficult to treat, to be honest. Pustules and nodules, relatively, if you put the correct medications on it, you should be fine, but these can stick around forever. So whiteheads and blackheads are essentially the same thing. The only difference is that whiteheads have a white top and blackheads have a black top. And they're both filled with the same, I guess, oil and dead skin cells, and they're essentially just pores that are plugged. And the reason why blackheads are black is because it's exposed, the oil is exposed to the air, unlike whiteheads, which have a very, very thin layer of skin covering it. And that oil and dead skin cells, once those are exposed to the air, they tend to undergo a series of chemical reactions that we call oxidation, which causes the color, which is originally a light beige, to turn black. And which gives the appearance of blackheads. And then lastly, we have our papules. So our papules are these small discolored bumps. They don't really have any pus in it. They don't have really any pain associated with papules. They're very, very tiny bumps that are slightly a shade or two darker than your skin. All right, so so your skin is covered, I guess we already went over this a little bit. Your skin is covered in millions and millions of pores that just sits at your hair follicles. So pores, this is very annoying. Why is this not going away? Wait 1 second. Let me just turn this off. How do I turn this off? That should be good. Sorry, guys. That thing was really, really annoying me. Okay, so your skin is covered in millions of pores, and your pores connect your epidermis to the subcutaneous sebaceous gland, which is the subcutis, which produces and releases sebum containing dead keratinocytes continually into the hair follicle and skin. So, okay, that was a really long-winded sentence, but your pores are located at the site of your hair follicles, and as your oil glands continually secrete oil into those hair follicles, as we just talked about, it leads to a buildup of oil at the base of the hair follicle, which is the perfect breeding ground for bacteria. And here we can read on: if the oil gland produces too much sebum, which is the type of oil that our skin produces, the overflow of oil can clog the pore, forming a bacteria-filled plug in the gland. The bacteria can multiply. These bacteria can lead to an infection, swelling, and inflammation around the clogged pore. So yes, basically what we just talked about. P bacteria can replicate and cause inflammation at the base of our hair follicles. And that can lead to infection, inflammation, and a lot of swelling. There, we can take a look. So what you will notice in all of these is that the red part, which is the base of the hair follicle, is swollen or inflamed. You will really only get any of these acne-like symptoms if it's inflamed at the base. So if you have blackheads, those could potentially develop into actual acne, like papules and pustules, because, well, the base is already inflamed. Just not as pronounced as in some other types of acne. Okay. So, what are the triggers of acne? Certain things in your environment can contribute to your acne, or they can make your acne breakout worse. So, I did not mention hormones, which is probably the biggest singular cause of acne, but here are some of the other things that could potentially cause or make your acne worse. So, wearing tight-fitting clothing and headgear like hats and sports helmets can actually cause acne. I don't know if you guys have ever played hockey, but I played hockey for a season or two, and the helmet was way too small for my head, and it was like pressed really, really hard against my forehead. And then what I started noticing was that at the site where it was pressed against my head, I developed these very, very tiny papules. So these very tiny, tiny discolored bumps that did not have any pus in them. My guess is that that gave a lot of strain to my skin and then ultimately caused a form of acne. I was pretty lucky. Papules is it's probably the I guess least noticeable form of acne. So I didn't really notice it. And then once I stopped playing hockey, it went away. And then air pollution and certain weather conditions, especially high humidity, can also cause acne. So a lot of people during the summer are more prone to acne because you're sweating more, and that leads to a lot more, I guess, a lot more foreign substances on your skin, and that could lead to irritation. And if you keep touching your face and wiping your sweat off, that could put extra bacteria onto your skin, and that could lead to infection as well. So high humidity weather and just the weather by itself could cause acne. Like I have friends who have the most perfect skin ever in very, very dry New England where I go to school. But the moment they come back to Shanghai, which is like very it's on the more humid side, they break out insanely. So just different weather conditions could cause acne. And then this is probably one of the bigger ones, using oily or greasy personal care products like heavy lotions and creams, or working in an area where you routinely come in contact with grease, such as working in a restaurant with frying oil. So cosmetics related acne is very, very common. So going to Sephora, I can tell you straight up that like 70% of the products for sale are gonna clog your pores. They're gonna trap too much. They're not gonna allow your skin to breathe, and that can clog your pores and basically just, clogging your pores ultimately leads to acne. But which is the reason why you should look for some of the um, comedogenic ingredients, which are ingredients that are going to clog your pores. Comedogenic means clog your pores, literally. And yeah, ingredients, and basically try to avoid those as much as possible. Because I'm really obsessed with skincare, right? So I took all the time to learn some of the most popular and the most common skincare ingredients. For example, most skincare ingredients start with agua, which is water, and then followed generally by something called glycerin. Glycerin is a very hydrating ingredient. This one is a good one. It's not comedogenic, but there are some other ingredients. For example, um, palmitic acid, which is a very commonly used in many, many, many different skincare ingredients, and these are going to clog your pores so badly. And yeah, just like notice what the ingredients is. Don't just follow trends, because a lot of the trends are, I guess, if you really look at them, they're really not worth following. Okay. And then stress. This is also a very big one. Stress can cause very, very severe acne. I had really severe acne because last year school was really, really hard, and all of that stress can just make any existing conditions that you already had under your skin worse, and speed up the breakout process. So definitely practice mindful breathing, practice, I guess, mindful stress control, because um when your stress goes over a certain threshold, it could really, really cause acne. And picking your acne can also cause more acne because you're introducing more bacteria, or I guess just the outside world and the tiny, tiny microbes floating through the air into your skin by breaking it. That could potentially lead to more infections at more places. So you definitely, and it also leaves a scar. So you definitely don't want to pick at your acne. And then milk and whey protein. So these are clinically proven to cause acne. Um, I don't really know why, but yeah, these are clinically proven. So if you already have acne or you're prone to acne, definitely don't drink as much milk and just any cheese or milk products. And whey proteins contain an overabundance of certain amino acids which contribute to acne. All right, so this is the big one. This is probably the reason why most people have acne in the first place. So, acne is largely a hormonal condition that's driven by androgen hormones. So, I'm not sure if you guys know what hormones are, but hormones are these, I guess, they are these steroids or these compounds that basically regulate how your body functions. For example, let's see. Um, if when okay this is okay so when your mom is giving birth to you, your body releases a hormone that's very famous. It's called oxytocin, that basically tells your mom to push harder and harder. Oxytocin, while doing that, also minimizes their sense of pain. So hormones are absolutely vital in basically everything in regulating our bodies. We would not be born without the assistance of oxytocin. And yeah, and hormones, and this special hormone called testosterone, which is a sex hormone for males, also named androgen hormones, could actually cause a lot of acne. Um, and testosterone is typically very, very active during the teenage and young adult years. So generally, when we first get our period, that's when we get our first spike in testosterone hormones, and that could contribute to acne because some people, their bodies aren't really in balance. For example, I was like, when I first got my period, I got really, really bad acne because my body was like, oh my gosh, what is going on? And it has gotten better over the years, but it does take a lot of time and adjustment. So for women, premenstrual acne is also very common because hormonal activity fluctuates, and our body doesn't really like fluctuations in hormones. It likes things to be in balance, to be continually in balance. And and every month when our period comes around, our hormones go haywire, and as a result, that could cause a little bit of acne, especially around the jawline and your chin. So sensitivity to testosterone combined with bacteria on your skin and sebum can result in acne. So yeah, so this is what testosterone looks like. It's got 3 carbon rings and hold on. Excuse me, sorry. All right, so what can you do to help with your acne? So there are 3 different types of treatments. So we have our topical treatments or over-the-counter treatments. We have our oral treatments, which are only available prescription by prescription. And then we have our therapies or cosmetic interventions. So our topical treatments include 4 broad classes of treatments. So we have our retinoids, our antibiotics, azelaic acid, and salicylic acid. So our retinoids are generally adapalene, tretinoin, and tazarotene. So Differin is actually the only type of only brand of adapalene that is available over the counter. I've gone through vials and vials of Differin. It's very, very effective. I would recommend Differin definitely if you have mild to moderate acne. Um, I think tretinoin, personally speaking, is better for blackheads and whiteheads than it is for our inflammation-driven acne, like pustules and papules. Um, I haven't actually used tazarotene, but I've heard some great things. And then we have our antibiotics. Generally, we don't recommend antibiotics like clindamycin and erythromycin by themselves because I'm not sure if you guys have learned about antibiotic resistance in your biology class, but antibiotics or bacteria, which antibiotics are designed to kill, bacteria is very, very intelligent. Um, Antibiotics will kill off the bacteria that do not have resistance to that antibiotic. But um, if you're unlucky, some bacteria are, I guess, born with certain mutations in their DNA that give them natural resistance to these antibiotics. And if you think about it, if your antibiotics are killing off the bacteria that do not have resistance, it leaves behind all of the bacteria that have natural resistance to the antibiotic, and as time goes on, those will remain even as you continue to apply your antibiotics, and then it will divide and multiply and replicate, which leads to what we call antibiotic resistance. So that's the reason why we don't want to give bacteria the time to develop resistance. So clindamycin and erythromycin, which are the two topical forms of antibiotics, that are, depending on which country you're in, available over the counter, but they generally are not recommended to be used continually for more than 8 weeks. However, here's the catch. There is a wonderful ingredient that scientists have invented in the last couple of years that is my personal absolute favorite. It's called benzoyl peroxide. It's not an antibiotic. It's the way it works is incredible. I don't really have time to talk about it here, but scientists have found that if you use benzoyl peroxide, like a benzoyl peroxide face wash in conjunction with an antibiotic, it could actually make it significantly better and significantly lower the chances of the bacteria developing antibiotic resistance. So if you really, really want to use an antibiotic, definitely use it in conjunction with some benzoyl peroxide products that can make the entire thing better. And then we have our oxalic acid. So this one is, I guess, less commonly used, but it's still a great ingredient to use. Oxalic acid is a naturally occurring acid produced by yeast, and it has several natural antibacterial properties. So this one I recommend generally for mild acne. If you have a little bit, then this is definitely for you. And salicylic acid. So this is the one that dermatologists absolutely obsess over. Salicylic acid has many, many, many benefits. It basically, the way it works is that it's able to penetrate really, really deep into your skin, and then basically resolve the plug or the inflammation very down below before it even comes into the surface. So salicylic acid is great for preventing acne, for curing acne, albeit it's a bit slower than some other things. And it's also really great for blackheads and whiteheads. I've been applying salicylic acid religiously for the last couple weeks, and it's already helped me significantly with my blackheads on my nose. Now they're just completely gone. You have no idea how happy I am. But definitely salicylic acid in just literally any concentration will be able to help you. So our oral treatments, these are only available by prescription only. So here are the 4 different types. We have our antibiotics. So unlike the ones that you can apply topically onto your skin, these antibiotics are very, very potent. And they also, however, cannot be taken for more than 8 weeks because you can still develop antibiotic resistance when taken orally. So the first line of defense, or the most potent of antibiotics, is called minocycline. Um, and doxycycline. So minocycline and doxycycline are part of a broader class of antibiotics called tetracycline. The tetracyclines are the most effective. However, some people don't really react well to them. So if you don't react really well, you have your other choices, which is erythromycin. And I've never heard of this before, but definitely antibiotics is generally the first line of defense. First thing doctors will prescribe you if you have inflammation-based acne. And these can be incredibly effective. So, and then we have our contraceptives, or birth control. So basically what contraceptives or birth control does is that it combines progesterone and estrogen, which are two different types of hormones. And there are a gazillion types of contraceptives. All of them work differently. So that's the reason why a lot of women experiment with different types of contraceptives to see which one works the best for them with the least side effects. So contraceptives are notorious for having a lot of side effects like weight gain, breast tenderness, and nausea, among a gazillion others. So yeah, I have many reserves against contraceptives, but it is sometimes necessary for people's skin to get better. And then we have our anti-androgens. So these are generally used for people whose acne is caused by testosterone, which is a male sex hormone, and which is generally the case for people in their teenage years. So spironolactone is the biggest anti-androgen medication available. It is often used when antibiotics fail. And spironolactone, I have a couple friends who went on spironolactone. It has incredible effects. This girl in my advisory, she had really severe acne, and then in just 3 months on spironolactone, it completely went away. It was miraculous. So it can be very effective when antibiotics fail, and it blocks the effect of androgen hormones on the oil producing glands. So androgen hormones can no longer speed up or make your clogged pores any worse, which then ultimately makes the whole thing better. And then we have isotretinoin. This is I guess, the gold standard, or this is the last line of defense that is proven to work for over 85% of people. It permanently cures acne, at least permanently, as in like at least 2 years. And within 2 years, you won't have any acne. And it basically works by making your your oil glands produce less oil. And well, that just basically cures the condition from its roots, because an overproduction of oil is what causes acne. So then if you make your oil glands produce less oil, then you simply won't have acne because you won't have the inflammation, the infection. So it's a derivative of vitamin A. There are many available brands on the market, some forms of isotretinoin, but it has many potentially dangerous side effects and long-lasting side effects. What's the most interesting thing of all is that isotretinoin is the most effective out of the four, but it also has the most side effects. Some side effects include permanent muscle and joint issues, liver damage, and dry eyes, dry mouths, yeah, and then dry skin, obviously. So therapies. So these are, I guess, cosmetic interventions. We have light, like blue light, yellow light, red light. These all have different benefits. However, they're mostly used for very mild acne, or just to improve the appearance of blackheads and whiteheads and pores. And then we have our peels. So peels have much greater concentrations of salicylic acid, glycolic acid, and just every other type of acid. And it is generally used for mild acne, like blackheads, whiteheads, and papules. And then extraction. I know this one is kind of counterintuitive because I just talked about how picking at your acne could exacerbate or even cause acne. But when done professionally with professional tools, these tools are completely sanitized and completed without touching your skin. They're done with metal tools, stainless steel tools that are sanitized, that are completely free from bacteria. That does not increase the chances of you getting more acne because it's not introducing any foreign substances into your acne. So these are generally used to help remove whiteheads and blackheads and or cysts. So this could really help because cysts tend to stick around forever, but you don't really get any more cysts. You just consistently have the same number of cysts on your face. So extracting a lot of the pus and inflammation from the cysts can really help with curing the condition. And then oh oops, I forgot to change the name here. But there's also steroid injections, which is a shot directly into the cyst or the acne, which directly just immediately resolves all of that oil and inflammation. This I had a friend who underwent steroid injections, and his face it has changed forever. Like he doesn't get any more cysts anymore. It was miraculous, but okay. So here are your product recommendations. Um, these I have personally tested every single one of these. I have gone through 3 of these face washes. This is the one I still have in my bathroom. Like I just used it this morning. This is the benzoyl peroxide face wash by Panoxyl. This is my personal favorite benzoyl peroxide product available in the market. And trust me, I've tried a lot. It's available in 5% to 10%. I have very, very insensitive skin, so my skin doesn't react to anything really. So I use the higher concentration. If you have sensitive skin, definitely start with benzoyl peroxide 2.5% or 5%. Panoxyl has all of those available options. So definitely benzoyl peroxide face wash is the one to go for if you have very mild acne. It by itself could probably cure it. And then we have our Clean Cure Advantage Spot Treatment. This one is all of these options are very affordable, by the way. And it's a combination of salicylic acid and I don't really remember what the other one is. I think it's salicylic acid in conjunction with a few other acids. And as I said, salicylic acid has really the potential to prevent and cure a lot of your acne. So definitely this is going to take more time to show its effects, but if you persist, it's definitely a great product. I've used it plenty of times. And also the Cicaplast Balm B5 by La Roche-Posay. This one is really question. Regular scrubs. Okay, so someone asked a question if regular scrubs work for acne too, or is it just for taking away dead skin cells? So that's a great question. The word for taking away dead skin cells is called exfoliation, and scrubs, depending on what they are, could help with both conditions because basically just the act of exfoliating itself actually helps tremendously with acne, right? So that's the reason why a lot of acne is treated with like salicylic acid, because what salicylic acid does, it's a very, very powerful exfoliant. It increases the rate at which dead skin cells are stripped away from your skin. So definitely scrubs do help. However, I do want to say that you want to avoid St. Ives at all costs. St. Ives is terrible for your skin, especially that apricot scrub. Like, it's absolutely terrible. People have like, if you use that, it's gonna cause these tiny, tiny tears in your skin, which is terrible. Do not avoid St. Ives at all costs. Um, I feel like if you have mild acne, then definitely use the actual treatments that I list here. But if you just have some blackheads, some whiteheads, or you just want to exfoliate your skin, regular scrubs are great options. So yeah. I can recommend a few scrubs if you guys want, but we'll go through this first. And then we have this moisturizer, which is one of my personal favorites. A little goes a long way. It has many ceramides and other very, very great ingredients built into this moisturizer. And I've gone through a couple bottles of this already. It's great. And then this is my favorite sunscreen by Paula's Choice. This is just great. It doesn't really, it's not sticky. It dries down matte, and it's just great for everything, and it's also SPF 50. So basically the higher the SPF, the better it is, and a 50 is very, very good for just really any normal everyday wear. And it's very hydrating as well. Believe it or not, whether your skin is oily or not, or dry, your skin is okay. So oily skin is actually a consequence of dry skin. I know it sounds counterintuitive, but because your skin is dry, your face is like, okay, I'm too dry. I'm gonna have to produce more of the oil, which then leads to what we see as oily skin. But the base of the problem is that your skin is dry, which is the reason why it produces so much oil. So if you hydrate it correctly and your skin is no longer that dry, your body won't need to produce as much oil, and your oil production will decrease quite a bit. Because some of my friends before, like, they would literally just never apply moisturizer, and their face got more and more oily. But once they started moisturizing correctly, their entire condition improved a lot. Okay, so the slide before, this is for mild to moderate acne, but if you have severe acne, then still use benzoyl peroxide face wash, but incorporate minocycline hydrochloride, which is one of the best antibiotics for the first 8 weeks, and afterwards, and repeat if necessary, if your condition does not improve significantly. If you do not react well to antibiotics, or it has no effect on you, it's probably time to try for spironolactone or isotretinoin. And what we generally like to incorporate as part of a severe acne skincare regimen is a hydrating mask. So these actually can help a lot with your acne. So this is one that I have liked, I've used a lot in the past. It's by Dr. Jart, and it's very pretty turquoise, and it's very, very hydrating, and it feels very cool on your skin. And of course, always wear your sunscreen, because a lot of these products, like benzoyl peroxide, salicylic acid, all of these ingredients make your skin more sensitive to the sun. So you need to make sure that you're protecting your skin adequately from the sun, so you don't sustain any damage to your skin. All right. Okay, that was our recommendation for acne, and now we'll talk about post-inflammatory hyperpigmentation, or in other words, scarring. So acne, especially severe type, can damage the skin and the tissues beneath it. So because acne causes inflammation, the body responds by sending these white blood cells and various other healing substances to repair the damage. And this can lead to post-inflammatory pigmentation or scarring. So here are a few of the examples of what it looks like. So this girl, she has some mild scarring, and she has a little bit more, and she has even more scarring. So yes. Okay. Oops. not moving. So why do we have scarring? Like why do we leave behind a scar after we have acne? So, well, it depends on which layer the acne is found in. So, when post-inflammatory hyperpigmentation or is confined to the epidermis, inflammation causes the release of mediator molecules that signal our melanocytes. So, remember, melanocytes are the pigment-producing cells that cause melanoma that we talked about last time, the type of cancer that stems from melanocytes, to produce excess pigment. And then that distributes itself to the surrounding skin cells, which then leaves behind the characteristic dark brown mark because of that extra melanin or pigment. And then when post-inflammatory hyperpigmentation is found in the dermis or in the deeper layers of the skin, then especially in the stratum bacilli, which is basal cells at the junction of the epidermis and the dermis, that could cause large amounts of pigment to be released. And then the special pigment, the free pigment, is consumed by special cells in the dermis, which then ultimately produces a blue-gray appearance at the site of inflammation. So these can take much longer to go away. A lot of people require, I guess, laser treatments to get these permanently off because there's just so deep in the skin. So what can you do about it? All right, so treatments. Treatment is twofold. You need sun protection. Just period, you need sun protection because it's very well researched that post-inflammatory hyperpigmentation can get significantly worse if you do not protect your skin from the sun. Definitely apply an SPF 50 broad spectrum sunscreen, the one I recommended to you, Paula's Choice, best, hands down, best sunscreen I've ever used. And then wear protective clothing and stay in the shade as much as possible. And for topical treatments, there are many different ones. Yes, so the ones that are more commonly, I'm not going to go through all of these individually because there's just so many. Hydroquinone, niacinamide, L-ascorbic acid, tretinoin, which is also used for acne, kojic acid, arbutin, and glycolic acid are just a few of the available treatments. But because there's so many, I'm just going to directly recommend a few products for you guys because I've used every single one of these ingredients. So, and some of them work better than others. So these are my product recommendations for you. One of my favorite brands is The Ordinary. I'm not sure if you guys have heard about it, but it's very affordable, like very affordable. Like this serum is, I think it's like $10. It's like $10, not even $10. And it's very high concentrations of these ingredients. And so niacinamide is a great for your skin. It helps. It works a bit slower than some others, but it has long-lasting moisturizing and benefits for your skin among many others. So this niacinamide 10% plus zinc 1% by The Ordinary is one of my absolute staples for my skincare routine. So if anything, if you have some pretty good skin, then definitely this is something to incorporate to just improve the overall appearance of your skin. And then the alpha arbutin 2% plus hyaluronic acid, also by The Ordinary. So alpha arbutin is a very powerful skin lightening agent. It's especially if you are consistent with the application. For example, like I've seen, actually, I have when I was in 9th grade, I wrote this paper here. I wrote this paper about all of these ingredients. I can show you guys really quickly what some of the effects are. All right, so niacinamide. So you can see here 2 months of niacinamide 10%, and it's quite obvious. So before and after 8 weeks, you can see this really dark mark here basically disappeared, and basically the overall appearance looks much brighter and healthier. All right, and that's just 2 months. Imagine if you continued for a whole year. And then let's see, where's arbutin? Alpha arbutin. Kojic acid. There we go. So you can see this is so as I said, arbutin and hyaluronic acid is very potent. This woman over here, she had some very severe pigmentation, and see what 1 month of arbutin did. That difference is very stark. And then we have, let's go back. So we have glycolic acid 7% toning solution. So glycolic acid is an exfoliant. What it does is that it removes dead skin cells at a much higher rate. And I'm not sure if I have a before and after picture for, oh, I do. So it's, I guess it's less noticeable of difference, but you can see that a lot of her blemishes and imperfections got smaller in size, and she has fewer of them. So this is just one thing I like to incorporate, because you have to use a toner anyway. So like, why not use one that's going to help with the exfoliating process? So that's what I always do. I haven't this the ordinary glycolic toning solution is actually also great for your scalp, because believe it or not, your scalp is also part of your skin. That's the reason why if anything goes wrong with your hair, you also go to a dermatologist. But it's also important that you continually exfoliate your scalp, because that helps with the health of your hair, as well as generating more hair. So definitely, I exfoliate my scalp once a month with this glycolic acid 7% toning solution. And I don't know, I haven't really seen any difference, because I've only been doing it for like 3 months, but we'll see. I'll tell you guys if I see any difference. And then skin cuticles. So this one is a little bit more on the more expensive side, but I haven't this specific one. It helps with redness and discoloration, and I haven't really used this by myself, but I've seen some great reviews online. Like, people rave about this, and so is discoloration defense. So I don't know. I haven't really used any of these myself, but I've heard some great things. And we have the Supreme Photo Plus Gel, and this one just really helps with brightening and all of that. It's a more calming, I guess, more cool alternative to the serum forms that you see above here. So these are all serums. Every single one of these are serums except for this gel. It's more cooling. And okay, this is also from The Ordinary. Vitamin C suspension 23% plus H and hyaluronic spheres 2%, also by The Ordinary. So I don't really like the consistency of this moisturizer. So this is a moisturizer, but it works wonders. Like, it's very potent. And let's see, I have a before and after picture. Well, there we go. So this one takes a bit longer to work, but 3 years or 2 years of vitamin C, you can see, yes, there's the difference is very obvious. And then alpha arbutin and ascorbic acid or vitamin C. This is also a very powerful combo. I haven't really used this one by myself, because I've been just using the niacinamide and the alpha arbutin with a vitamin C moisturizer, but I guess theoretically it should work pretty well, because ascorbic acid and alpha arbutin by themselves work very well. And the AHA 30% and BHA 2% peeling solution. So this one is very famous across the internet. It's this like very dark pink peel, and people generally, and it's very concentrated acid. So AHA and BHAs are two types of acids. I think this is called an alpha hydroxyl acid and beta hydroxyl acid. So there are two different types of acids that significantly speed up the process of skin turnover, and they're both by The Ordinary. So Yeah, so here are just some of the products that are tried and true. I have used all of these by myself or most of these by myself. And of course, I've used all of the products that I've recommended to you up here. And definitely, if you are struggling with acne or any type of scarring, or you just want to get brighter skin, definitely incorporate some of these products into your skincare routine. And the ordinary is incredibly affordable, so like you can never I guess run out of the ordinary, because like I think this is like $4 and then this is like $15. It's great. So I have a lot of the ordinary, and this serum specifically, the niacinamide and zinc, the consistency is incredible. Definitely it feels much more high end than it actually is. All right, so we don't actually have any homework for today. Basically, just go back and shop a little bit on Sephora or something like that. And yeah, I hope this class helped you guys with a few more products that can help you. And next time, we're going to talk about aging and what you can do to prevent it. Um, okay, perfect. All right, see you guys.
All right. Thank you.
Thank you.
See you next week.
Bye.
See you.